Is frozen hip a thing? This commenter wants to know. I'm Dr. Wendy, I'm a physical therapist. I've taken care of women for 20 years, and here's the thing. Frozen hip really technically isn't a thing. It could be a thing. Frozen shoulder is a adhesive capsulitis, meaning that the shoulder capsule has shrunk down, specifically the coracohumeral ligament in the shoulder has changes, and it has a very specific hormone thyroid connection. Now, in the hip in women, here is what I see in clinic that maybe could make you think this. The hip is an interesting joint. It is a very solid, hardy joint. Well, wait, let me get a hip model. I always am looking for a reason to get out my vintage hip. Okay, so here is my femur, and this head of my femur goes into the acetabulum of the pelvis. What happens to women as we age is we will get degenerative changes. And if you were an athlete, yeah, you're having changes. But what can happen is this acetabulum can get what's called lipping, which is basically bony growth. So as that happens, I like to think of that as like Pac-Man. So your acetabulum can get bony growth and come around. And so it can give you the feeling that your hip is frozen. But really what it is it is a limitation within your joint, a bony limitation that can cause some hard infields that can make you feel frozen. If you have a history of hip dysplasia, that makes it worse because you were already a little bit funky. You can also get changes to the head of your femur, not just your acetabulum and your pelvis. That can cause problems as well. You can also get a labral tear, just like you have a labral tear in your shoulder, you can have a labral tear in your hip. Now, labral tears in the hip can make you feel unstable, they can have deep pain, but oftentimes these people don't feel like their hip is frozen. Now, some women have pain on the outside of the hip, which is called greater trochanteric bursitis, or it is a referral pain from their bony hip pain. But we have found that bursitis that most people think that they have, that pain on the outside of their hip, is 80% of the time a glute med tendonitis or a micro tear or a glute med tear. I actually see this the most common in my everyday practice, not piriformis syndrome, glute med tendonitis. And remember, tendonitis is basically micro tears within the tendon. So because women have a wider pelvis and a wider Q angle, their hips are wider. And if you get weakness and you're sitting more, you get atrophy, then your tendons change if your hormones change. And so the glute med tendonitis starts to take over and cause massive pain. Many of my women that perimenopause, menopause, postmenopausal have glute med issues that are significant, glute med tendonitis, partial tears, full thickness tears. When the patient gets a full thickness glute med or glute min tear, that is a hot mess express of pain. They have a significant limp. Nothing makes it better. No exercise makes it better. PT does not make it better, not usually. And oftentimes those women have to have a surgical procedure to heal it. So a frozen hip, my guess, if I had to bet, would be a glute med issue with hip stiffness from possible degenerative changes and stiffness within that joint. But this is why I'm a big advocate for women doing mobility, such as Pilates, doing yoga, doing a functional range of motion like a CARS hip mobility routine, and strengthening. Now, if these things sound very foreign to you, I can make another video, but go and check my mobility playlist to learn about more hip mobility. Hope this helps.